All right, this is chapter 21. We're going to focus on the lymphatic system. We're going to just mention a couple of things about the immune system, and I've shortened this PowerPoint just a little bit. The functions of the lymphatic system. The main function is listed here. The main function is to return excess fluid back to your blood vascular system. At the capillaries, we talked about the capillaries in chapter 20, and the capillaries are leaky, and they allow fluids to seep out into the tissues that are surrounding the capillaries. Well, we have to get that fluid back into the cardiovascular system, and there is a mechanism in place to pull it back. It's the osmotic pressure. The albumin inside of the circulation will bring that fluid back into the circulatory system, but it's not perfect, and so there has to be some help for the cardiovascular system, and that's what the lymphatic system will do. It's going to drain excess fluid from the tissues. If there's a problem with the lymphatic system, then it causes swelling or edema. Other functions include returning small proteins back to the circulatory system. Normally, proteins should stay in your blood. They shouldn't leave the blood vessels. However, if they're small enough and if the capillary is leaky enough, they can leak out, and we can't keep those proteins in between the cells. So the lymphatic system will return those small proteins back to the circulatory system. And then in the intestines, there's a little bit of a lymphatic capillary called a lacteal, and it's mentioned later in the PowerPoint, but the lacteal absorbs fats, like the triglycerides and the individual small lipids. Functions of the immune system, and this is a pretty easy read. It's for protection, protecting your body from pathogens and antigens that want to harm your tissues in the inside. So the lymphatic system and the immune system will work together in order to protect your body. We're going to go over the parts of the lymphatic system. We're going to talk about all the lymphatic vessels. So these are vessels like arteries and veins. They're actually more like veins, but instead of carrying blood, because they do not carry blood cells, they are carrying fluid that comes from the tissue. Once that fluid enters into the lymphatic system through the lymphatic capillaries, it's called lymph. So tissue fluid is lymph. All that fluid is collected and is sent back to your circulatory system through your subclavian veins. Once we start going over the individual parts of the lymphatic system, we'll start with the smallest thing possible, which is going to be the lymphatic capillaries, and end with the very largest part of the lymphatic system, which are the lymph ducts. This is part of what I wrote down earlier. Other functions of the lymphatic system: collect excess tissue fluid and any blood proteins that have escaped the circulatory system, and then to return that fluid back to the bloodstream. All right, the smallest of the lymphatic system are the lymph capillaries. The lymph capillaries are similar to blood capillaries, but there are some differences as well. They have flaps in between the cells of the tissue of the lymphatic capillary, and that's how fluid can get into the lymphatic capillary. And then the very end of the capillary is closed-ended, which means it's not open to the tissues. These spaces in between the cells, and we'll see a picture here in a minute, shows that it is a one-way flap, if you will, or one-way valve. So whenever fluid goes into the lymphatic capillary, it does not come back out, and it can only flow towards the heart. The lymphatic capillaries lead to the collecting lymphatic vessels, and these are larger than the capillaries. And this is where we start to see some lymph nodes. You may have heard the term lymph node before. Lymph nodes are kidney bean-shaped structures, and they have germinal centers inside the lymph node, and they're full of T cells and B cells, and they help clean the lymph as it passes through the lymph node. We'll go over the anatomy of the lymph node later. And then the collecting lymph vessels, whenever they converge, they form larger lymph trunks. And then the lymph trunks will converge and form the largest vessels of the lymphatic system, or the lymph ducts. And there are two main lymph ducts. There's one on the right side of the body, the one on the left side of the body. The one that's on the right side of the body is called the right collecting duct, and the one on the left side of the body is called the thoracic duct. All right, I mentioned this earlier in the PowerPoint, but now we have it written down, so we can just highlight a few things. The lymphatic capillaries are not only are they the smallest, but they're located near the blood capillaries. And then whenever they receive their tissue fluid, they pass between the cells in these mini valve flaps. It's a one-way entry of fluid only. It does not flow back out. Now, it's not just tissue fluid that goes into the capillary. Some proteins that escape from the cardiovascular system will also go through the lymphatic capillary. And then also some pathogens like bacteria and viruses and even cancer cells can go into the lymphatic capillaries. And then hopefully the cells, the germinal centers inside of the lymph node will take care of the bacteria, viruses, and cancer cells. There's a specific type of lymphatic capillary found in the small intestinal wall, and they're called lacteals. So lacteals, they absorb digested fats, or fats that have been absorbed through the intestinal lining will then go into the lacteal. But instead of calling the fluid inside of a lacteal lymph, it's called chyle, C-H-Y-L-E. So chyle is absorbed fats from the small intestines. Let's go ahead and draw on the labels on this picture. We'll start in the upper left-hand corner right there. The blood capillaries are going to be right there. Those are the systemic blood capillaries. And then we have the lymphatic capillaries located inside or around the systemic capillaries, and they're draining tissue fluid, the lymph. And then lymphatic capillaries will gather together and converge to form the collecting lymph vessels. That's what they're showing here. And then the collecting lymph vessels get together and they form the lymph trunks, and lymph trunks get together to form the lymph ducts. All right, see, lymph nodes are going to be these kidney bean shaped. Lymph trunks going to be right here. All right, now let's look at the picture right below it where we have the tissue fluid. This is showing you the capillary bed up close as well as the lymphatic capillaries and showing the direction that the tissue fluid is going to go once it enters into the lymphatic capillary. So the tissue cells, they're all around. That's what those are. And then the blood capillaries are going to be right there. And then the lymphatic capillaries right there and just all throughout the systemic capillaries. And then we have this picture right here showing just the lymphatic capillary. We won't worry about those filaments, but we have the endothelial cells, which are going to be right here. And now you can see the flaps in between those cells. They're shown right there, where fluid can go into and through the flap into the capillary, but then it can't flow back out because then the flap closes. All right, so the lymphatic capillaries lead to the collecting lymphatic vessels. I want to note that the collecting lymphatic vessels will lie right next to blood vessels. And as blood is flowing through the blood vessels, you can feel the pulse in some of the arteries. And that pulse will help propel the blood towards the heart. And then also there are valves inside of these larger collecting lymphatic vessels, just like veins have valves, and they help direct the flow of the lymph. So speaking of which, this needs to be changed. Hang on. Let me switch to my marker. Helps direct the flow of lymph, not blood. In the cardiovascular system, there's the heart that is the pump that creates the pressure gradient in order for blood to flow through the cardiovascular system. Well, the lymphatic system does not have a pump like a heart. So there are other mechanisms to help propel the flow of fluid or the lymph back to your cardiovascular system. One, use the skeletal muscle pump, which is also used with the cardiovascular system. But as you flex and extend the limbs and the upper limbs and lower limbs, it helps push and propel the fluid past those valves and towards the heart. It uses the pulse of the nearby arteries. I mentioned that in the last slide. And then the tunica media of the larger lymphatic vessels. Notice that the tunica media is the same term we used in the cardiovascular system for the blood vessel walls. So the same words apply to the larger lymphatic vessels. So the tunica media is smooth muscle. And smooth muscle is involuntary, and it constricts the lumen, or it can dilate to open the lumen, and it helps propel the lymph towards the heart. There are structures located along the collecting lymph vessels called lymph nodes. The lymph nodes looks like a kidney bean or a bean-shaped structure. It is used to cleanse the lymph from pathogens. There are cells inside of lymph nodes. They are antibodies There are T cells and B cells, and they help clean the lymph of pathogens, bacteria, viral infections, and also maybe even some cancer cells. There are superficial lymph nodes and there are deep lymph nodes. We're just going to focus on the superficial lymph nodes. There's some in the neck. They're called the cervical lymph nodes. So the cervical region or cervical lymph nodes are in the neck. Axillary lymph nodes are accumulated in the armpit. And then the inguinal lymph nodes are located in the groin. Let's label a couple of things in this picture. The cervical lymph nodes are going to be in the neck, so they're right there. Axillary lymph nodes in the armpit, so they are right there. Inguinal lymph nodes in the groin, and they're located right there. Now, the different colors on this chart shows you the area of the body that is drained by the right lymphatic duct, and then the area of the body that is drained by the left thoracic duct. And you'll see that the areas of the body that drains the lymph through the thoracic duct is a lot larger than the area that is drained of lymph in the right collecting duct. So that makes sense that the left thoracic duct is actually a lot larger than the right collecting duct. I'm going to go ahead and draw on the lines for these labels. This is showing you a typical lymph node. The lymph that's going into the lymph node enters through these vessels right here, which are the afferent lymphatic vessels, and they show an arrow of the direction of the flow of lymph. So it comes in through the afferent lymphatic vessels. Now there is going to be a capsule on the outside of the lymph node. It's a fibrous connective tissue. It's very tough. It helps prevent the spread of infection. So all that infectious material that's inside the lymph node does not leak out to the surrounding tissues, or any infections from the surrounding tissues doesn't leak in and then infect the lymph node. So the capsule is on the outside of the lymph node. The trabeculae is the arrangement of the reticular fibers of connective tissue that form an internal skeleton of sorts inside of the lymph node. It separates the lymph node into compartments, kind of like cubicles separate different office areas inside of a building. So the trabeculae, those are the inner walls made of reticular fibers. When you look inside each trabeculae, or inside each cubicle if you will, you'll see that there's a ring of cells like that, or right there. Those are the germinal centers. Those are the cells that have the T cells and the B cells, the antibodies. So as the lymph enters into the lymph node, they circulate around the germinal centers, and then it makes its way out through the efferent lymphatic vessels. So the efferent lymphatic vessels are those right there. So lymph goes into the lymph node through the afferent lymphatic vessels, and then they leave through the efferent lymphatic vessels. I skipped over the section on the lymphatic trunks, and I think in the study guide it says no, the different types of lymphatic trunks. Don't worry about that part. Don't worry about that part of the study guide as well. We're just going to go ahead and talk about the lymphatic ducts. So the lymph ducts, those are the largest of the lymphatic vessels, and there's two main lymph ducts. There's the thoracic duct, which is on the left side of the body. Let's look at where it enters. It enters at the junction of the left internal jugular and the left subclavian veins. So where the internal jugular and the left subclavian vein come together, then it forms the brachiocephalic vein. At that junction, that is where the ducts bring the lymph. That's how the lymphs return to the circulatory system. So the thoracic duct is on the left side, so it's the left internal jugular and the left subclavian vein. And this is going to be the larger of the two ducts, and this is the duct that drains 3/4 of the body. And then we have the right lymphatic duct. It's on the right side of the body, and it's right there at the junction between the right internal jugular and the right subclavian vein. All right, let's go over some parts of the immune system. We're not going to go into too many specifics. We're just going to stay with general knowledge of the immune system. The main cell of the immune system are the lymphocytes. And we talked about lymphocytes way back in chapter 18 when we talked about the parts of blood. The lymphocytes are a white blood cell. They are agranular white blood cells, and they're also the smallest of the white blood cells. These are the ones that become the T cells and the B cells. And these are some of the structures used in lymphatic and the immune system. We've already talked about lymph nodes. Lymph nodes are found along or among the lymph collecting ducts. Then there is the spleen. The spleen is in the upper left quadrant of the abdomen. If you remember way back in chapter 1, we separated the abdomen into quadrants. We took a horizontal line straight across from iliac crest to iliac crest and went right through the umbilicus. And then we took a vertical line starting at the very tip of the xiphoid process of the sternum and goes straight down to the umbilicus, and it ends at the pubic bone. And it separates the upper and lower quadrants above and below the horizontal line, and then on the right and left sides of the vertical line to differentiate between the right and left. Anyway, so the spleen is in the upper left quadrant of the body, and we'll look at what that does here in a minute. Then we have the thymus. The thymus is posterior to the sternum. Tell you what, writing with my finger is not the same thing as writing on the whiteboard. So the thymus is posterior or behind the sternum. Then we have tonsils. Tonsils are located around and in the nasal and oral cavity. They have some tonsils in the upper part of the pharynx, behind the nasopharynx, and then we have some tonsils in the oral pharynx, and then some tonsils right underneath the tongue. We'll review those locations at the end of, or towards the end of this PowerPoint. And then there is something called aggregated lymphoid nodules. We'll look at those in the digestive system as well as the appendix. The appendix is located, it's attached to the first part of the large intestine. The aggregated lymphoid nodules are found in the small intestine. All right, so the thymus, remember it is posterior to the sternum. This is where the T cells or the T lymphocytes mature. T cells start as lymphocytes that are made in the bone marrow, but then they make their way to the thymus. And the thymus produces some hormones in order to mature those lymphocytes into T lymphocytes. We had thymopoietin, we had thymosin, and we talked about those hormones in chapter 17. Now the thymus is most active in childhood. That is when it is the largest. But then after childhood, as we get older, the thymus starts to shrink and it calcifies and makes it less effective, which is why we're more prone to infection as we get older. We've already reviewed lymph nodes, so I'll let you read through this part of the book, and we'll just go ahead and continue on. The spleen is in the upper left quadrant. It is the largest of the lymphoid organs. It acts like a lymph node. So the blood circulatory system will travel through the spleen, and then the spleen will remove some blood-borne antigens, just like the lymph nodes will do. Plus also the red blood cells that are old and ready to be destroyed and to be broken down, which takes about 120 days, that takes place inside of the spleen. So the spleen removes worn out red blood cells and breaks them down, tries to reuse as much iron as possible from the red blood cells so it can make more hemoglobin, so it's going to recycle the iron. Now also the spleen as a fetus, that is where hematopoiesis occurs. Now after birth, hematopoiesis occurs in the bone marrow, but as a fetus it happens in the spleen. Now this is showing you the main types of tonsils. We're only going to talk about 3 of them. We're going to look at the palatine tonsils. They're located by the palate. The lingual tonsils, which are located by the tongue. And then the pharyngeal tonsils, which are located behind the nasal cavity. Let's look at the next picture. The pharyngeal tonsils, those are the ones that are most superior, and they're right there. They're located behind the nasal cavity. They're also known as your adenoids, if you've heard of that before. And then we have the palatine tonsils. The palatine tonsils are located close to the hard palate. They're behind the oral cavity, and they're also located in the oral pharynx. And then the lingual tonsils are located right there. It's actually a part of the tongue. Now you can remove the pharyngeal tonsils, and you can remove the palatine tonsils during a tonsillectomy. The palatine tonsils are the ones that are most commonly removed. The pharyngeal tonsils, the adenoids, can be removed as well. The lingual tonsils cannot be removed because it is part of without removing part of the tongue at least. All right, so that's the last little bit that I have for this chapter. So the next thing we'll do is the respiratory system, and then that's going to be all of the PowerPoints for your Unit 4 exam. Email me if you have any questions.